Okay, so picture this. You're in the ICU hooked up at all these machines, and you're probably thinking, man, this is rough. But get this. A huge number of ICU patients, we're talking like maybe even 80% in some cases, develop something called hypocalcemia.
Yeah, low calcium.
Low calcium, exactly. And we're diving into this new article, Management of Hypocalcemia in the Critically Ill, to figure out why this is such a big thing in the ICU.
Should be interesting.
So when we think calcium, we usually think, strong bones.
Right. Milk.
Exactly. But it's got to be way more complicated than that.
Oh, for sure. It's not just about chugging milk.
So break it down for us. What's calcium actually doing in our bodies? Why do we even care if it's low?
Great question. So first, you got to think of calcium in two main places. Inside our cells, which we call intracellular, and outside our cells, what we call extracellular.
Okay, so two totally separate things. Got it.
Exactly. Now, here's the wild part. Almost all the calcium in your body, like a huge 99%, is actually stored in your bones.
Really? So are you saying only 1% is actually doing stuff?
Yep. Just 1% is floating around in your blood and tissues. That's the extracellular calcium.
Wow, 1%. That's crazy. So that tiny bit is doing all the heavy lifting.
You got it. That's what we measure in blood tests, and it's controlled by these hormones to make sure it stays balanced.
Okay, so that makes sense. It's like keeping things running smoothly.
Exactly. It's how our nerves talk to each other, how our muscles contract, even how our blood clots. Crucial stuff.
Wow. Okay, so what about the other 99%? The calcium in our bones? It's just chilling there.
Well, it acts as this reserve, like a calcium savings account that your body can tap into when it needs to.
Handy.
Right. But what's really interesting is what's happening with calcium inside our cells, the intracellular calcium.
Oh, right. We were talking about that earlier.
It's basically like a little messenger inside our cells sending signals that kickstart tons of important processes.
So like a chain reaction.
Exactly. Muscle movement, cell division, even programmed cell death. It all relies on those calcium signals.
Wow, so it's like the director of everything going on inside our cells.
Exactly. But here's where things get tricky, and this might surprise you. But too much calcium inside your cells, that's actually a bad thing.
Wait, too much calcium is a bad thing. You're blowing my mind here. I thought we were always told to load up on calcium, drink our milk.
It's all about balance, right?
Right.
Think of it this way. The right amount of calcium sends a normal signal, but too much is like setting off an alarm bell.
Oh, I get it. So
Right.
it's like too much of a good thing can actually be harmful.
Exactly. It can even trigger those cells to basically self-destruct.
Wow, that is wild.
Yeah.
So we've got this mineral that's supposed to be good for us, but too much of it can actually be wreaking havoc inside our cells. That's pretty crazy.
It's all about finding that sweet spot, right?
Totally. So how does all of this delicate dance of calcium inside and outside our cells, how does this all tie back to what's happening with those critically ill patients in the ICU?
Okay.
Okay, so we've got calcium, this super important mineral, doing all these crucial things inside and outside our cells. But then being critically ill throws a wrench in the works. The article says hypocalcemia is crazy common in the ICU. Why is that? What's making calcium levels go haywire in these patients?
It's like a perfect storm, right? It's not just one thing. The article talks about two big culprits. Systemic inflammation, which is basically like your whole body freaking out, and then organ dysfunction, especially with the kidneys.
Right, because those are both like classic signs of being critically ill.
Exactly.
But how does that actually lead to low calcium? Fill in the blanks for it.
Okay, so picture this. Your body's in crisis mode, right? It's fighting for its life. So it releases all these inflammatory molecules called cytokines. They're like little SOS signals telling your body something's wrong.
Okay, the alarm bells are going off. Got it.
Exactly. But here's the thing. Those cytokines, those little SOS signals, they can actually mess with the hormones that normally keep our calcium levels in check.
No. So the body's own response to being sick is actually making the calcium problem worse.
You got it. One of those hormones is PTH, parathyroid hormone, which helps pull calcium from your bones when you need it.
Right, like tapping into that calcium savings account we talked about.
Exactly. But if those cytokines are messing with PTH, it's like suddenly you can't access your savings account when you need it most.
That is a great analogy.
Yeah.
So we've got the inflammation messing with our hormones. What about the organs? How do they play into this whole calcium drama?
Well, remember how I mentioned the kidneys? They're like the filters for your blood, right? They decide how much calcium to keep and how much to get rid of.
Right, like a very important balancing act.
Exactly. But if your kidneys aren't working properly, which happens a lot with critically ill patients, it throws that whole balance off.
So you're losing calcium because it's not being reabsorbed properly.
Exactly. You're getting it. And it gets even more complicated because some of the treatments we use in the ICU can actually make hypocalcemia worse.
Oh, no. It's like adding insult to injury.
Totally. Like some medications we use, like diuretics, they're supposed to help by removing excess fluid, but they can also make you lose calcium in your urine. And then there's citrate.
Citrate. What's that?
So citrate is often used in blood transfusions to stop clotting, and it's also used during CRRT, which is like dialysis for really sick patients.
Okay, so important treatments. Got it.
Right. But here's the thing about citrate. It can bind to calcium in your blood. And when that happens, your body can't use that calcium as easily.
It's like the citrate is hogging all the calcium, so it's not available when and where it's needed.
You've got it. And that's just a few of the reasons why this whole hypocalcemia thing is so common in the ICU. It's like this perfect storm of the illness itself, the body's response to the illness, and then sometimes even the treatments we're using to try to help.
So we've established this, right? Low calcium. Super common in the ICU. And it's not just about, like, forgetting your daily glass of milk.
Right. Way more to it.
Way more to it. But, okay, here's where this article gets really interesting. It's like, hold on. Should we even be treating hypocalcemia in these patients?
Yeah, it really makes you wonder.
If it's so common, why even worry about it, right?
Well, the article makes a good point that a lot of times these ICU patients with low calcium, they aren't showing the usual symptoms.
What do you mean?
Like you'd expect muscle spasms or tingling, maybe even heart problems, but those classic signs, they're often missing in these patients.
So it's like a silent problem. But still, it's got to be a sign something's off, right?
Right. But then the article throws another curveball. A lot of times this hypocalcemia in the ICU, it just goes away on its own.
Get out of here.
Yeah.
So what? It's just a blip.
It can be, yeah. And that's where things get tricky because researchers still don't really know if the low calcium itself is actually dangerous for these patients or if it's just a sign of how sick they are overall.
Okay. So, like, is it the problem or just a symptom? It's like seeing smoke and thinking fire. But maybe it's just someone blowing out a bunch of birthday candles.
Exactly. Perfect analogy.
But, and this is what gets me, even with all this uncertainty, they still often give calcium supplements to patients in the ICU.
It's true.
So why are we treating it if we don't even know if it helps? And it could even be doing more harm than good. It just seems strange.
It's a good question. And the article really digs into this. Like, there's really no solid proof that giving calcium supplements actually makes things better for most critically ill patients. And get this, some studies actually say it might be harmful in certain situations.
Harmful, really? Like what?
Like severe infections, sepsis, even after cardiac arrest, it might not be a good idea.
Hold on, I thought calcium was supposed to be good for your heart. How could it be making things worse?
Yeah, it seems counterintuitive. But remember how we talked about how too much calcium inside your cells is a bad thing?
Yeah, like a calcium overload.
Exactly. So in sepsis, where those cells are already super damaged and inflamed, giving more calcium could actually make that damage worse.
Oh, wow. So you're trying to help, but you might just be throwing fuel on the fire.
It's a real possibility.
Okay, so doctors are seeing this, right? They see it doesn't always help, might even hurt. So why is giving calcium in the ICU still so common?
That's the million-dollar question, right? Part of it is probably just habit, you know? Doing what's always been done. For years, everyone thought calcium was great for your heart, especially in the ICU. But newer research, it's challenging that idea.
So we might be holding on to old ideas even when the evidence is changing.
It happens. Yeah.
It's like when you get a fever
Yeah.
and you immediately take medicine to make it go down. We want to fix the symptom, but maybe we should be figuring out why we have a fever in the first place.
Exactly. Great analogy. And that's what researchers are trying to do with this whole hypocalcemia thing, right? Figure out the root cause.
Makes sense. So what about vitamin D? Everyone's always talking about vitamin D and calcium. Couldn't that be a better way to go?
Good point. Vitamin D, it's crucial for how our bodies use calcium, right? And researchers are definitely looking into its potential for these really sick patients.
So what are they finding?
Well, the article talks about this one review of a bunch of different studies, and it actually suggests that vitamin D might be helpful. But of course, more research is needed.
There's always more research to be done. So what are they hoping to learn about vitamin D? What's the big question?
Well, here's the interesting part. Some researchers think that vitamin D might not be acting just by, like, boosting calcium levels. They think it might be working on a deeper level, maybe calming down that whole body inflammation we talked about.
Oh, interesting. So instead of forcing in more calcium, it's like vitamin D is helping your body get back to a good balance naturally.
Exactly.
Right.
And there's actually some early research that supports this idea. Like, one study found that giving vitamin D to critically ill patients didn't immediately change their calcium levels, but it seemed like there might be some long-term benefits.
Interesting. So maybe it's working more behind the scenes,
Hmm.
you know, supporting the body's own healing process.
Right, which is always the goal.
This whole deep dive on calcium has been pretty eye-opening. Like, we started off thinking about strong bones, but it's obviously way more complex than that,
Yeah.
especially for people who are really sick.
For sure. It shows how much we still don't know and how important it is to keep asking questions.
Totally. Like, even with something like calcium, what we think we know is probably just the tip of the iceberg. And when it comes to treating people in the ICU, it's not always as simple as it seems. Sometimes the best approach might be just letting the body do its thing, help it heal itself.
It's powerful, that natural healing.
It really is. So, here's something to think about. If this whole hypocalcemia thing in the ICU might not be the enemy we thought it was, what other medical practices could we be getting wrong? Are we so focused on treating symptoms that we miss the bigger picture? What do you think? Let us know on social media. We always love to hear your thoughts. And thanks for joining us for the deep dive.